Many websites and doctors say about the miracle of childbirth through a natural delivery. But what about birth by cesarean? There are many reasons why a woman would need a C-section. But what they want to know is, why do they need it? How many other women have had it? What is it? How is it done? And how does it feel? Recently, I had a son, and he was by C-section. I was scared, I didn't have enough information, and I didn't know why I was getting it. So I know firsthand how it feels and the lack of information about C-sections, whether if it's planned or unplanned. Unless you look it up for yourself, you're in the dark. Babycenter.com was my best resource for all the information that I did need. Granted, it was 3 months late, I still needed to understand. Although there are many questions behind a C-section, the main focus is what a C-section is, how many women get them, and the risks that are involved. That, I believe, is one of the most important facts that we need to know. First, let's talk about the risks. There are many risks in a C-section, considering it is major abdominal surgery. Babycenter.com states that moms who have a C-section are more likely to have an infection, excessive bleeding, blood clots, more postpartum pain, a longer stay in the hospital, and significantly longer recovery. Also, a large study found that babies delivered by C-section at 37 to 39 weeks experience breathing problems. A percentage of 5% versus 0.5%, courtesy of MSNBC.com. If planning to have more children, the risk to the mother and the baby increase with each surgery and each child. Even though there are many risks, there is still a good number of women who elect to have C-sections. Some women have a C-section because of a previous abdominal surgery, much like a myomectomy. It's a surgical removal of fibroids in the uterus. Dr. Judith Reichman, a Today contributor, states that over 1.2 million births a year are performed with abdominal surgery.
The suggested rate for cesarean births are 5 to 15% of all births. And the rise in occurrences of C-sections since 1970 has risen enormously. In 10 years, it is predicted that the births in the United States will count for over half of its population.
On the other hand, unplanned C-sections are due to trouble during childbirth, much like a vaginal breach or even placental abruption. That's when the placenta starts to separate from the uterine wall. Now that we know the risks and the reasons for a C-section, an important thing we need to know is also what a C-section is. A cesarean section, or C-section, is delivery of a baby through a surgical incision in the mother's abdomen and uterus. Babycenter.com states that according to the Centers for Disease Control and Prevention, about 33% of women who gave birth in 2009 had a cesarean. Now that we have a little more information about C-sections, it's important to remember that women have to find their own information about them. There are many women who get them, be it planned or unplanned. And they are highly risky, considering it is a major surgery. Again, recently I did have a C-section. I was scared, I was confused, I didn't know why I needed it. But in the end, the joy of holding my son and the joy in my family's eyes was well worth it. Granted, I was blessed enough throughout my pregnancy to have the help of the YWCA, and I had a nurse come to my home. And when I told her I had to have a cesarean, she explained some things to me. But not all women are that blessed, and not all women have that. Always remember that in the end, though it hurts, and though even 3 months later you may still be in pain, and your body out of shape, you'll have your son or your baby girl, and the smile in your family's eyes afterwards. Thank you.